am here with a panel of very influential brothers that are about to talk to us about the reopening of the states. We've got Philip Mahkyle here, entrepreneur. We've got Jim Dupree here as he's a philanthropist, does a lot of different things. We got Mahkyle Catalano here. He's a physical therapist. Frantz Latten, artist.
Frantz Latten.
Frantz Latten. Nicholas Robinson, the real Dr. Nick Robb. He's a pharmacist out in Dallas. We got Dr. Bryant. He's an orthopedic surgeon. And I think that's all of us, right?
Absolutely.
So I think we kind of wanted to call a town hall today because we know that a lot of the states and areas are now reopening, and you guys have all seemed to have some type of influence or have done different things throughout coronavirus and conversations and topics, and a few of you are doctors and actually on the front lines of this thing. So we wanted to get together to kind of talk about how you guys are feeling, what you're thinking, what you know, how can we kind of educate people and help them understand what's going on and what's happening as it relates to coronavirus and reopening the states and some precautions that we should all be taking. So with that, I kind of wanted to open the floor and just kind of see, you know, this whole stay-at-home order from the beginning that we knew about coronavirus and what was happening with COVID. How serious were you guys at first, or at what point did you feel like it was time to really be serious about this virus? Because I know a lot of people weren't taking it serious at first. Brian, I'll let you go first.
Yeah, so I can be honest. I wasn't that serious about it. I think it was a mixture of a couple of different things. One, I was on vacation. I was in Montego Bay, Jamaica, at a good friend's wedding. When my hospital pretty much sent an email to all the employees, letting us know what's going on, kind of the change of scenery in the nation, and just how things are going to drastically change. There was a little bit of misinformation from our federal government, I can't lie as well, saying it's just the flu, don't worry about it, yada, yada, yada. It wasn't until we started seeing the cases go up and the death toll just tremendously, you know, rock New York and some of those other places that, like, we noticed things were a little bit different. So yeah, at first I was like, yeah, it's not too bad. But then I changed that thought quickly.
Yeah. So Mac, I know that you're also in the medical industry as a physical therapist. So what kind of ways or how has coronavirus affected you guys?
I think Dr. Bryant really hit it on the head in regards to initially nobody knew how serious to take it. I think when the NBA first shut down on March 11th, that's when it was like, oh my God, yeah, what's going on? We've never seen this before, right? So this really is just one big experiment right now because we've never done any of this. You know, everything's based on modeling. The social distancing, the lockdown, it's all based on modeling. So I think initially we all wanted to be more safe than sorry, but right now it's like, where do we go from here in regards to, you know, are more people being affected from the virus itself or the actual shutdown that we've put in place? Yeah,
that's fair. Dupree, I know you've had some kind of strong thoughts about why things are different in different places. And I'm interested to hear your perspective as how you feel it's transpired, because when this thing first came out, the conversation was African Americans can't really get coronavirus. That was our first wave of thinking. Then we started being, you know, affected a little bit more than other groups. And now it's kind of like, you know, everybody is free game. So what's your perspective on that?
Well, the fact that African American, when I remember we were talking about, we were laughing about it back then, that was just kind of tongue in cheek. But because for me, the way I looked at it, because it looked a little bit more like the trend, where I'm big on history and I would read up on different pandemics. And I read a lot about the malaria when they first started to record it back in the 1700s and stuff like that. And I was looking at that, and the pathogens in terms of how it was described kind of seemed similar. It would slowly creep up on your breathing pattern. So it wasn't like, so for example, if you have like the doctors will tell you, if from pilots, we know that if the temperature drops, they will pass out. But if you climb in Mount Everest, it slowly drops, it creeps up on you. That's kind of the idea of what this was. Mm-hmm. And I said, okay, I remember watching a video that came out of some Asian country, and they trapped a dude. It was a demonstration video. It wasn't real. He came out of the car and then they trapped him with a basket and pulled him. And we're laughing about it. We thought it was funny, but I wasn't laughing. I thought this was serious because I figured, because I'm big on politics, I remember when Obama was saying, look, if we had a pandemic of this kind of proportion, et cetera, we need to be ready. Because I'm also big on politics, I know in September of 2019, we already disbanded our pandemic response unit. So I knew there was going to be a problem if it crossed over. Mm-hmm. And time matters. And it became an issue. And yeah.
Yeah. Okay. I'm going to open this up to any of you. And what do you guys think now that stay-at-home orders are being lifted in different places, and you know that people are like screaming to get out and do things? Like, how are y'all feeling about some of these initial reopenings, even with the capacity measures in place? What are y'all thinking about this?
Well, I'd like to say that businesses are suffering the most. I think the country as a whole is experiencing a form of cabin fever more than it's an emergency to get out. I think people just want to be out. People want to socialize with each other. But now, being that bills are still due and businesses still have rent and whatever overhead they might have to pay, those bills are still due. Everything is still due. So if you have, in order to stay open, you need customer, you need commerce, you need to exchange goods and services for money. Mm-hmm. And if you don't have the money, your business will suffer. Your life will suffer. You may lose your home, you may lose your job, whatever. So now that is an actual concern for people, because we're 2 months in, maybe about, and it doesn't look like the end is near. It looks like we're going to be like 2 to 3 months of no earning, but still owing money. Mm-hmm. It's now become more than just getting out. Now, in order to survive, you have to get out. You have to do things. Mm-hmm. So I think the backlash isn't just people just want to be out and getting out and hanging out. I think people want to get back to work because they need money to pay for their lives to move forward.
It goes right back to being prepared. We were not prepared for this at all. I'm not talking about us as people. I'm talking about the government. When you have a response unit that is supposed to be prepared, that's okay. You do 1, 2, 3 things. If something happens, that's why we have geniuses. These guys are doctors. They know stuff. Like if I have an issue, I go meet them and they treat me. If something happens, you're supposed to know what you're supposed to do. Things are supposed to be in place. For example, if the government had a pandemic response or epidemiologist response unit, you're supposed to know that if these things happen, then you're going to create some sort of quick government shelters. You can build extra hospitals. You can put money out for people. You can count by census how many people we need to send some money to. Whatever Frantz is saying right now is true. Yeah, people they're distressed. They don't have any money.
Right.
It's because was not ready for this. They didn't prepare at all.
But what about Dupree?
When you have elected officials that are we've elected officials to be able to handle, like you said, these are genius level people. They are supposed to be the leaders of our country. And if they don't have a plan for this, why do our leaders not have a plan for this? That is why you are elected. That is why you hold these offices, so that when emergencies happen, you have the answers. Because I don't have the answers. We don't have the answers. Right. Or maybe we do, but we're not in positions of power to enact anything.
Some of the top people back in October last year, 2009, did, the Event 201, the pandemic exercise simulation. And that's something that seems to happen every year. So if we have some of the top people that are planning for this every year, how come we weren't more prepared? That's a big question people are asking.
In October, in October, that was kind of, they needed people to go into medical service fields and for cabinet positions. But in September, the pandemic response unit that Bush, not Obama, Bush put together right after the 2002 outbreak, he did it in 2005. That was heavily funded and regenerated in 2009 by Obama because they thought it was going to be helpful. That's gone now. You don't have that. They just put that back again in March. They just put it back up in March.
The current administration closed that, right? If I'm correct, the Trump administration put a stop to.
Yeah, that's correct. They did.
To that,
Yeah, they stopped. They defunded the World Health Organization. They cut funding to the CDC. These are all things. America is a country of crony capitalism. Let me put it like that. It's unfortunate. I love a capitalistic society. We all make money off it. But when you go to crony capitalism where you're going to make money regardless of what's happening, then you have a problem. You spend way more money for the federal, we're talking about defense. You spend what, 700, almost 800 billion for defense, 65 billion for education. That was the numbers don't lie. You spent 700 and something billion for defense, and then you put 65 billion for education, and you still cut the education one year later. That's why we have a problem right now.
This pandemic has shown that the leaders of the country don't really care about the people so much as themselves or big business.
So yeah, I'm gonna say I think we clearly were not ready for this, no question, hands down. I think at this point now, right, reopening the United States is a controversial issue. I mean, you look at it from an economic standpoint, right? We got almost 26 million people filed for unemployment. The first quarter of GDP is down like 4.8%. I mean, you got oil prices dropping tremendously. I mean, like from an economic standpoint, I mean, we're in the Great Recession, arguably could be in the Great Depression if it continues to go that route.
Yep.
So yeah, opening up the United States, I can see from an economic standpoint, from a capitalistic society as we are, is important. I mean, I think from the medical standpoint though, I mean, you have to be ready. We weren't ready back in October, November, January, December. Now we're trying to reopen, we have to be ready. I mean, they keep saying the same things. You need a test. You need a contact trace. What does that mean? If you got infected, you have to find out who you were around. You have to let them self-quarantine. Once you contact trace, you got to be able to have the resources in the hospital. Once you have the resources, you got to have the vaccine. You got to have the treatments. I mean, again, I think we have to open up because, I mean, it is important. Livelihoods are at stake. I mean, I have a mother that's owns her own catering company. She's a sole proprietor. I mean, I have my own other businesses outside of medicine. It's important. At the same time, we got to be ready. And I just don't know if we are right now, to be honest with you.
Can we talk real briefly about all the inconsistencies that we've been seeing from the beginning? I mean, initially CDC told us, do not wear masks if you're not a healthcare professional. It's really ridiculous to be outside wearing a mask when you could be getting fresh air. Instead, you're breathing your own air in. And obviously in a hospital setting, a doctor only puts a mask on when he's entering a room with a sick patient, and then he takes it off right before he leaves the room. So we have people wearing masks all day long against what were initial CDC orders, and then that's changed. And then obviously when we look on TV and we see all the politicians and leaders huddled together, not following social distancing, not wearing masks, what do we believe? What do we actually have?
Right.
Yeah, I'm interested to hear from Nick, because I know you're on the front line right now. You're actually doing COVID-19 testing. And so with that, like, what are you seeing in terms of like, are the tests flattening? And I know you probably are more involved in Dallas than other places, but I think this is probably an accurate depiction of what's going on across the country. So what are you seeing?
Yeah, so you're right. So I noticed that just like everyone's saying, it's important to get the economy open, to get everything flowing again. But at the same time, we're starting to realize that this virus, it's a novel virus, so it's new. So it's spun from the original family coronaviruses, so it's different, right? So every day we're learning something new. How long it lasts on surfaces. It's not a typical virus, which is why you're saying like no one really knows how to react to it, how we're going to treat it. Viruses are difficult to treat anyway. As far as being on the front lines and testing, let's just say that the numbers are still increasing. So you have an average infection rate of anywhere from 12% to 20. And we are still currently seeing that number at our site that we just started testing at also. And it's difficult to open the economy because of the fact that you still have people that come through and they seem asymptomatic, look fine, and then they come back with a positive test. So these are going to be the ones that are out spreading it to others, which then can lead to you spreading it to those that end up in the hospital, taking it back to your families, your grandmothers, people with other health conditions. So that is part of the problem of the opening economy so early without knowing how we're going to go forward as far as treating it and trying to prevent the spread like some of the other countries have done.
In regards to the actual testing, that's a great point. I just want to read the actual verbiage from the PCR diagnostic panel itself. It says, positive results are indicative of active infection with 2019 COVID, but do not rule out bacterial infection or co-infection with other viruses. The agent detected may not be the definite cause of disease. Then it goes on to say negative results do not preclude 2019 COVID infection and should not be used as a sole basis for treatment or other patient management decisions. So it's basically saying if you rule, if you're tested positive, that doesn't necessarily mean that you have it. And if you're tested negative, it doesn't mean you don't have it. And we know there's been a lot of false positives and false negatives. Can we talk about that?
Yeah, I think, exactly. What you're referring to is sensitivity, specificity, false positive, false negative rate, right? Well, one, there's multiple different type of tests. I believe the test that Dr. Robinson and Walgreens is administering is the Abbott ID now, I believe, test. There's multiple different type of tests. They test different things. Some test viral partigen, some test the antigen, other different portions of it, whatnot. I think the false positive and false negative rates can differ depending on the type of test, and it also depends on the prevalence of the actual virus or the actual disease at the time. So if you're in an area like New York, like Phillips and Manhattan, where the incidence is way higher versus somewhere like Arizona or something like that, your false positive rate will be a little bit lower in somewhere like New York because you have a higher prevalence. So it also depends on where you are.
And
but,
we still can't test for viral load, is that correct?
So certain can, however, it depends on what type of test you're getting. The faster ones don't test for viral load though. They're quick turnaround times, and that's the ones you need.
The majority of tests now are testing for either the presence of the actual virus itself, or they're testing for the antibodies. And then there are some tests that take longer, which can actually, like you said, can check for the amount of viral load that the person has. But I think now most people are focusing on trying to actually find out, are you currently infected or not? And then some of those tests have a small error percentage. The false negative percent is much lower than the false positive, but there's always that chance of error with any test, especially that's a rush to market like they did now.
So right now I see that there's about 1 million or 1.1 million confirmed cases, and there's only 62,000 deaths. I'm interested to hear if you guys know of any previous situations that we've been in that looked statistically like this one, or the situation was similar, and how that process of people coming back into society and being comfortable with that went. Because right now, I think it's just a lot of people that are not hopeful on the end of this, and now just extremely cautious in their behaviors moving forward, regardless if we're talking about coronavirus or not. So are there any previous situations that look or felt statistically or kind of operationally in the country that happened of this stature?
Just to chime in real quick, the flu 2 years ago, 2017-2018 season killed over 80,000. And the Hong Kong flu in 1968 killed over 100,000 in the U.S. But
we never responded that way.
We've never responded that way ever. This is a brand new experiment, what we're doing right now.
Yeah, and this being so new, the concern, because we had the H1N1, we had SARS, we've had any number of diseases, or you can't call them pandemics, but any number of infections, viral diseases that have swept, I could say, the country, but it's never stopped commerce.
Right.
And this country is actually built on that.
Yeah.
From top to bottom. So when you look at the leaders that are benefiting from this, and the average citizen that is being hurt from this, we don't have a blueprint for not working. Yeah. Americans work. We work through everything. Any natural disaster, Katrina, 9/11, we pushed through it. Mm-hmm. We've always pushed through it. We've always made money. Commerce has never stopped. America has never stopped. This is the first time that America has actually ground to a halt.
Right.
And it shouldn't be up to us to find a solution. I don't pay all this money in taxes every year and elect all these officials and go out and vote and do my research and do all that to come up with a solution to this problem. It should be taking, somebody should take the reins and take control of the situation.
So Philip, I'm interested, to Frantz's point, to hear your perspective, because as a major guy in the financial analysis field and entrepreneur, how do you feel about what Frantz is saying in terms of us feeling like we have to reopen just to get back to work?
There's a lot of validity to that, obviously. It is unprecedented that everything shuts down like this, and I'm very confused about it. And I don't quite know what to make of it, but since it is what it is, what I'm seeing from just how commerce is moving is that I'm seeing a lot of industries that have been, just like how we're connected here versus it being an actual panel.
Right.
On one end, it opens up the forum and it opens up the conversation to more people. And I think you're going to start to see more industries migrate in that direction, become virtual. Again, we have some medical professionals here. There's ways, I'm sure, that they have performed their work in ways that they probably wouldn't do before or wouldn't even conceive of, simply because it goes, no, that is inadequate. But now that it becomes a necessity, I just look at things from that standpoint. What kind of innovation will this bring? Because as human beings, we're naturally wired to survive and adapt. That's ingrained in us. So I'm starting to see that's just what I look for trends. And I'm starting to see a lot of industries move in that direction, innovation coming up and things of that nature, simply because, to the point before, was that we have to work. So we have to figure out a way to adapt to the circumstances as they are. Even something as something that requires physical, or you would think, interaction, such as the medical field. Right. And that's sort of what I'm seeing. But yes, it is totally unprecedented that stuff is being shut down the way that it is. And it is definitely going to change a lot. And I think when we get on the other side of things, we'll see that there's a lot of industries that are going to be changed forever. I don't think it's going to look the same as it did before. And I'm not sure, but that's what I see.
Let me respond a little bit to what he just asked about, what Chynell said about us not seeing something like this. We saw something maybe not like this, but similar. The H2N2 when Eisenhower. If you look back in history, when the H2N2 happened, he reacted almost like Trump. He said, you know what, we have enough stockpile in order for us to, get past this. And then when it got really bad, because Eisenhower is seen as a military type of president in terms of the way he governed, he course corrected. He knew what was going to happen. Mm-hmm. And then if you look at when polio was very, very big, the commissioner for health at the time was a woman. The reason why I'm saying all this stuff is messaging matters. There's confusion, like he just said. People don't know. There's people out there not wearing masks, this and that, blah, blah. Other developed countries, they have a centralized messaging system. When something happens, they go from the top to the bottom. Everybody got to do this. It's in unison. We do this, do that. We don't do that in America. They'll say, okay, let the states handle it. Let this handle it. Let that handle it. They push blame left and right. You got parents going into the hospital with no mask on. We've seen pandemics and epidemics before. They've shut down parts of economies. Matter of fact, we were in a pandemic when the First World War happened. We're in a pandemic post Second World War. But the country, as he said, we have this thing where we come together and we fight and we push forward and we make it work. But when you have elected leaders that don't give good messaging,
and have divided us.
Yeah, it was so bad. The messaging was horrible. If the messaging was okay, we wouldn't be doing this. People would be at home, people would be wearing masks, et cetera, et cetera. Messaging matters. You know, when, let me quickly say this, when the one that happened in Obama, what was that? The
9/11?
2009. The what? The swine flu, right? When the swine flu happened in 2009, I think it was I want to say within 5 days, meaning when the World Health Organization declared a World Health Risk and pandemic, 2 days later, America shut down. It wasn't shut down like this, but we declared an emergency, meaning the president can use his presidential powers to command certain things. Like what Obama did was he used his powers to command new facilities to be open as satellite offices for hospitals. And also he waived the way Medicaid and Medicare was being used to where a lot of people who had that issue were able to get into Medicaid and Medicare and get treated. Ask me right now, if I go get tested for COVID-19, will I get billed or not?
I don't think you will, actually. And again, it may differ from state to state. I know in our particular region, like COVID-19 testing, COVID-19 treatment actually is covered. But again, I can't speak to those that are in the Northeast region. They're not like that, but
not in Chicago is not.
Yeah.
I'm sorry, Illinois is not.
Yeah.
In Texas, I don't even think it's not. It is, because the reason why I know that is because I called just to find out what it'll take. First of all, in Fort Bend here, they were like, okay, if you're not showing symptoms, then you're gonna have to go to the website. But if you're showing symptoms, then we'll have to get you in. Yeah. So I said showing symptoms just to see. The first thing is, do you have insurance?
So it's depending on where you go to get tested. So if you're going to a private facility, doctor's office, a private lab, there are 9 times out of 10 charging for that. I've had some, employees and things that go and they went and the doctor's office charged them, but there's also the sites set up by the state and the government, and those are free, as well as those that are out now, like where you see where your pharmacists are out doing the testing, like at the Walgreens sites. Those are also free of charge also. So it just depends on if you're going for a private company. Now, most of the antibody tests, I believe those are definitely not free. Those are all private companies testing for antibodies to see if you have any immunity to.
Fort Bend Municipal set up 2 units. They are not free. I know that for a fact because they asked me if I had insurance, and I asked, do I have to pay? They said, you're going to have to pay for the test. Yes. So that's a government thing. That's not a free. To see if I could get it for free. And a friend of mine who is in Sparta, Illinois, she did it through the municipal as well. They sent her a bill for $40 for the test. She tested negative, good, but she got a bill. So my point is, if I'm not making any money, like Frantz said earlier, they're at home. There are people who their livelihood depends on them being out there.
They were deemed non-essential.
Exactly. And if I'm not making any money, and I have to say, okay, if they say, okay, you need to check before, let's say restaurants open and they say, we have to check you before you get in.
Whoa, that's a whole nother.
Let's say you have to check you before you get in, or show me papers that you've checked yourself.
Right. No, that would be a regression in the country.
Then I'm not going to go check. The government got to be better. They got to put some more money into the healthcare sector to do this for free.
At what point do we say that's enough? The government's already doing too much in regards to certain things. Like you just said, if you have to get tested before you enter a restaurant, obviously now they're saying you got to wear masks on a plane, even though that could be counterproductive for some that already have other illnesses. Now they're just repeatedly breathing in that same air for the course of 5 hours, 6 hours.
Well, the testing thing, I hope it doesn't come to that. I hope it doesn't come to that. But there was a solidarity that this country held. Any major disaster, any natural disaster, anything that threatened America, we would all unite under the stars and stripes, and we all wrap ourselves in the flag, and we come together as a country. And this is, again, back to the current administration, this is the first time that we are not solid as a people. Just think of 9/11, when terrorist attacks were happening on this country, people couldn't wait to start baseball games back and major sporting events and regather. That's what we did as a nation. We all came together and said, we need this. We need to come together. We can't be scared. We've got to show them that the terrorists aren't going to win, and that direction this country took. And now we are split, and the lines are glaring. There are definitely racial divides, but there's also a class divide right now. The rich are trying to. There was a dude that bought all the hand sanitizer in the world to capitalize off of this, not to help people.
Right.
Water started skyrocketing, food prices started, everybody was scrambling, toilet paper was nowhere to be found. We live in America, we've never run out of food or products.
Liquor sales, gun sales, everything up.
Right,
up,
everything has gone up because everybody wants to profit off the thing that someone else doesn't have, as opposed to us coming together and helping one another, or finding a solution for this problem. So the divide in this country is really showing itself through this pandemic.
Yeah, I think it's become. Go ahead.
Go ahead.
No, I was just gonna say I think it's definitely become somewhat of a moral dilemma. One, I think that multiple portions of the country right now are affected in different ways. Again, New York, New Jersey, Connecticut, they're not getting hit the same as, or they're getting hit rather worse than somewhere like, your middle America, right? Your Arizona, your Kansas. So someone who's in New York who sees their loved ones in the hospital, in the ICU, on a ventilator, or God forbid, passing away, they're like, no, we don't need to do anything. Versus someone else who has 100, 200 cases in their whole county, but they're at home and they have businesses that are going under, and they have mortgage that's due, and they have bills that are necessary to be paid. They want to get out, So I think that that's one of the problems. And then start to have people, like you said, it's a class type of thing. It's an economic thing where some people are like, I have to make money. If that means a couple people died, then so well. And there have been people that have said that and have to kind of back up their comments and apologize on national television for saying things like that. So yeah, I agree. It's somewhat of a moral dilemma right now, and people are putting, unfortunately, money over people and money over health. So.
Do y'all feel that staying at home is almost, or just continue it however long this goes through the end of the year, staying at home is more so like living your life in fear rather than living your life free?
Well,
there will always be some type of disease, and we take bigger risks with our lives every day.
I don't think necessarily in this circumstance, my bad, Matt, necessarily in this circumstance that this will be living in fear. It's more so being cautious. If we take a look at the countries that reacted faster and shut down all their economy and commerce, their caseloads are completely lower than here in the US. We had a delay from the administration as far as acting on this. So average in the United States is about 20 deaths per 100,000 people. If you go over and look at Australia, China, New Zealand, those countries that actually immediately said, hey, let's shut this down as long as it takes, they're only at 0.4 deaths per 100,000, 0.3 deaths per 100,000, 0.4. So that shows that shutting it down, staying at home as long as it takes to figure this out, because this virus it's new. We're learning something new every single day. Like something new comes out, right? It's like, oh, some tigers have it. Transmits on the bottom of your shoes. So it's spreading, right? So if you have to for that long, but I feel like we do need to find a way to adapt the economy to where we can continue commerce some kind of way with that.
Or suspend it, because I know that companies are still taking, like if you have automatic bill pay, there are companies that are still taking their money, whether they're open or not. For example, 24 Hour Fitness says the money that you're spending now for your April membership, even though they're not open, what they'll do, they'll take your money and allow you an extra month on the end of your, and that doesn't make sense because nobody needs an extra. First of all, you don't need an extra month after you've canceled something. I'm not coming back. I've canceled it. But to be so brazen, to be so brash as to close your doors to your stores and still take money from people it's mind-numbing to me. And that also forces people to have to then get out and work because I still have to pay these bills. If I'm staying home and not making money, but I have no bills, then basically I'm chilling. I'm gonna be bored, but I'm chilling. But if I'm at home compiling debt, I'm stressed out. I can't do that for very long. So that would lead me to protest, get out and not wear a mask or buy all the hand sanitizer and try to slang it on the block like it's cocaine or something.
I want to add as well, because you brought up question as far as are people living out of fear? And so I think this pandemic has created opportunities that, like for me, you know, I was a teacher, and as a result of the pandemic, I'm able to work from home, but I have a lot more free time. And so I've been able to venture out into other opportunities in which I'm learning a new discipline, but I'm also able to, I was able to like jump into the stock market and make a little bit of money from that, and also start a new business. So I think in one takeaway from it is, like for me, I'm not leaving my house because I know people, there's been a lot of people around my community and the community that I've served who have passed away from the COVID-19. And so that's enough for me not to leave my house, but it's not enough for me to take on this victimized mindset that will stop me from exploring other opportunities that have risen out of this pandemic or whatnot. And I think that's something to definitely consider, because with this crisis, there has there's a need. You know, there's more needs, and you could take advantage of that, just like the white people are doing, right? They're taking advantage of the fact that this pandemic is here, and they're figuring out ways to capitalize off of it. But I think it's something that we as people of color can do as well.
Yeah. Well, thank you. What's your name?
Amber.
Amber, thank you so much for your feedback. We appreciate you.
So Amber, real quickly, you mentioned you're not going outside. I want to chime in. Someone also asked us to address diet and lifestyle modifications, especially on the East Coast right now in the wintertime. We're all vitamin D deficient. We absolutely need that sun. So to be in our house for now maybe 60 days straight, there's some people I know that literally haven't left their house. That's very dangerous. You know, this is called a lock-in, a lockdown. That's a prison term, essentially. You know, a quarantine is for sick people, and if we're not sick, we're healthy, we still need to get outside. Obviously, don't get around anyone that, you know, potentially could have this virus, but you still have to exercise, you still have to breathe in fresh air, get sunshine.
Absolutely. So as far as going outside, I can clarify that. Like I can go to my yard or outside of my front porch. But as far as me just being around people until I know exactly how people are contaminating that disease, I'm not putting myself at risk, just because I have an elderly person who also lives in my house. And I don't think the government is being completely honest about how that virus is contracted. And there's been a lot, I'm on the East Coast as well. Like I'm in New York, New Jersey area. And as you know, this is, New York is the prime area of which these cases are developing or are increasing. And there's been teachers, nurses, you know, just a lot of people around the community that have passed away from it.
Yeah.
And let me just mention something. I think, I mean, we all know that this pandemic has a health implication, right? You know, it makes you sick. You know, some people are passing away, unfortunately. Has an economic implication. I mean, clearly, you know, unemployment, people can't work, you know, bills are due. I don't want people to forget about the mental standpoint of it as well. Like it definitely has an impact on your mental health as well. And because I mean, one, people are probably gonna have PTSD from this. I mean, people in the hospital. I mean, I don't know if y'all heard about. Maybe you guys in New York heard about the emergency room physician that committed suicide. While trying to help people, she got the virus and she just couldn't take it. So I want everyone to understand, like, there's a lot that's going on, but I do not feel that living in fear and just staying cooped up in your house is healthy. Now, I agree, you don't want to do things that put yourself in harm's way. You don't want to get around large groups. You don't want to not practice hygienic practices. You don't want to not wash your hands, etc. But you do want to take time to get out. You do want to take time to properly social distance, but get some vitamin D. Do something that brings you joy. Because I would be very, very, very weary of just staying at home and just hoping that everything kind of just gets better. Because we don't know, this could be the new norm. I mean, some people are suggesting that until there's herd immunity, which means about 60 to 70% of the nation is infected, and then by way of infection, immunized to it or has some type of immunity, that it's going to be like this. So that could be 12 months, that could be 18 months. And I don't think anyone should be cooped up for 18 months. It's just not healthy from a mental standpoint. So I would encourage everybody, although it is scary, although I agree, Amber, like there's probably some misinformation. We don't know exactly everything going on. But the things we do know that we can help ourselves with is wash your hands, wear your mask, social distance. You can get out as long as you're being safe. And so I would encourage everybody to please, if you can, get out, do things that give yourself some type of mental relief. But staying inside for the next 6, 12, 18 months is not going to be healthy.
Yeah, get a PlayStation or Xbox or something.
Yeah, y'all know I have a saying, and I post almost every day: get up, get out, get active. Because I think, in a healthy way, in a way where at a time that I was going through a lot in my life, just going for a walk or run outside definitely would change the mood of your day. And so I definitely would encourage everybody to still do that while practicing social distancing.
And Dr. Brian, you just spoke about this being the new norm. What about these terms, social distancing and lockdown? Those are all brand new terms for us based on mostly computer modeling. It's just one big experiment, but we're already so used to those terms. And someone asked about what if there's a second shutdown once we reopen. We're already being so desensitized right now to the idea that anytime a threat emerges, potentially we could have to go back into lockdown or quarantine or socially distance ourselves. So essentially, that could happen again, absolutely. And that's something we gotta address because of course the economic implications and the mental health implications outside of just the virus itself.
And this being the new norm, do you think moving forward, let's say a year from now, social distancing is still the norm? What do you propose that we do as a nation? Because again, I'm thinking money-wise. For example, if you own a business, obviously your money comes from the amount of people that patronize your business. And if social distancing is the new norm, you're not going to be making as much money. What happens to the economy then?
It goes online.
Excuse me?
It goes online.
Yeah, that sounds good, but if you
is that what everybody wants? Does everybody want to be socially separated?
It's not what we want. Like for me, everything you guys are saying is valid, but we have to look at how the country is structured. We're in a broken system. The healthcare system is broken.
But our healthcare system has been broken. It was broken before this.
Not comfortable going out. A lot of people are not comfortable going out just because if they catch it, they don't have insurance. So what are you going to do? Even people with insurance, it's almost like the insurance that don't work is inadequate. So we have a healthcare system that is broken. You have blown up fictitious job numbers because a lot of those jobs were in this factor, which, I mean, if you were making money and you were asked to stay home a month, let's say you didn't even pay rent, now you broke, we have a problem.
Yeah.
Problem. There's a lot of people who cannot survive a $400 emergency bill. So
But we give the Lakers 4 points
without insurance.
How much money did we give the Lakers? How much money did we give Shake Shack?
40 million.
They got like 46 million. They had to give it back. And my bad, my stuff timed out. What was I think Mac, you had a question, right? That I didn't get a chance to respond to.
In regards to this being the new norm with the social distancing and quarantining, and potentially that could happen to us anytime now another threat emerges. I mean, obviously these numbers right now in terms of fatalities, nobody wants to, have anyone that they know close to them pass away. But if you really look at the numbers, they're pretty much identical to a flu season just a couple years ago, and nothing else was shut down. Right now, we know that unemployment is the highest it's ever been since it was tracked. Liquor sales is up, gun sales are up, domestic violence is up, suicide is up, hopelessness and desperation is up, up, up. This is really a tough time, and there's a lot of implications aside from the virus itself that are not being addressed. And the leaders of this world right now, especially this country, are not giving us any timetable or any type of hope in regards to anything normalizing or easing up at all.
Yeah, no, I agree. I think the leadership right now has been, not a politician, but piss poor. That's just not even a question there. I think the terms like social distancing, staying 6 feet away, and things like that actually aren't new. Back in 1917, the pandemic that they had, they implemented these same we call mitigation things or locking down type of effects to actually bring down those cases and bring down those fatalities and whatnot. So it is a type of device that's been used before to try to prevent things like this from getting too worse. However, you're right. We don't have a timetable. We don't have a lot of things going on that will help us to feel a little more secure in knowing when this is going to be over. But some of the things we do know is that, if you have some type of treatment that can help, if you have some type of vaccine, if you have some ability to say these people are immune or these people are sick or these people are not sick, and you can trace it, then at least you can stop fires before they get too big. And I think that's what this new norm needs to be, not necessarily living, on lockdown, being, depressed, being in despair, but a new norm of finding ways to put out fires before they get too large. And that's where I think our leadership is doing a terrible job at, because one, they're not getting the testing we need, they're not getting the information we need, they're not doing a lot of it we need, even as healthcare providers. Again, there's things that change all the time, right? Going back to you talking about the masks, before they said they didn't want everyone wearing masks because they didn't want healthcare providers to not have masks in the hospital. Now they realize you could be an asymptomatic carrier, and you wearing a mask actually protects other people because you're not allowing those droplets and particles to go out of your mouth and out of your nose to possibly infect other people. And that was just information they learned as time went on. So I think, one, they need to let us know what's going on, be a lot more transparent. Two, they just need to rev up some things so that we could have this new norm, which is finding things, putting out fires, but still living a life that doesn't allow us to be cooped up. So, we need some leadership that does a little better.
Just to chime in on that real quick, the initial modeling done mostly by computers estimated that about 2.2 million Americans were going to die. So we responded according to that. Obviously, let's be safe rather than sorry. Now, seeing that it's nothing in that ballpark, I think we really have to readjust, and that hasn't been done at all. You talk about masks. Another implication initially was that a lot of people don't know how to wear masks properly. They're still touching their face. And now they're talking about if schools reopen, little kids should be wearing masks. And I think that's outrageous.
Interesting.
Yeah.
So,
Okay.
Now, I'm just going to mention about school opening as well. They also, you're right. They're saying if school does open, they want kids to start wearing masks. They want kids to be in desks that are 6 feet apart from each other. Schools that, you're supposed to change classes and change teachers. They want students in the same room all day around the same group of people. They want them to eat lunch or whatnot in the same place. So they want to do that, but they need better rules than that. 'Cause I don't agree with that.
The psychological effect that's going to have on the children is just ridiculous. And considering worldwide, maybe we've lost 1 or 2 children to COVID, if that hasn't even been proven. This is just, it's lunacy. It doesn't make any sense.
We've lost more than 2 kids. It's not, and I'm not disagreeing with your point. This is as doctors have said, this is a novel virus. And the difference between influenza and novel is just they haven't seen the way this one operates. So if it's changing and we're finding out they're finding out new things every day, it makes sense for us to be confused as to how people are reacting to it. So, but the one thing I don't disagree on the social distancing thing, because I don't want to die. I don't want somebody who I love to die. We've seen that it can kill somebody. This picture, you're in New York, you saw the big ice freezer trucks that they have out there putting dead bodies in. Like, those are things that those things is something that if you saw it, if I wrote a movie for Frantz, who's the actor, if I wrote a movie and I wrote in there, said, okay, so there'll be a hospital, there'll be freezer trucks out there, we'll put bodies in it. They wouldn't even want to do the movie. It's unbelievable. You're like, be like, nah, we're not doing that. You want to ruin my career. So that's my point. It's unprecedented times. We've never seen anything like this. So if they're bringing out new rules and regulations every day, I'm okay with it. I'm not, those I don't mind. Is how do we make sure people don't die? If you're gonna bill me to go to the hospital, are you gonna bankrupt? Okay, think about it. They lift the emergency powers tomorrow. They say, okay, no more federal lockdown. Everybody go back to normal. Do you know how many people are insured right now?
Not very many.
African Americans, a lot more African Americans are insured than white people in terms of percentage. So when you are uninsured and you get to a situation now where you can't breathe, you got to go be on a respirator, the doctors will tell you, do you know what it takes to put somebody on a respirator? You got to put a tube inside, outside, Rena, ain't this? They got to make sure you don't get blood clot, that you don't do this. It's so much. You got to flip the person here and there every day. It's a lot. And the economics will be overwhelming for whoever is sick. If they lift this and the government is no longer responsible for it to a certain degree, like so far, what are they supposed to do? That's my point. Right now, if you lift this and say, okay, everybody go back to normal. Go back to normal. I know a lot of people. Matter of fact, I know a lot of people I know at least 5 people who have had COVID, but they've made it. One person died, but the rest of them made it. The point is, if you lift this tomorrow, what is the plan in place? You don't have Medicare for all. You don't have universal health care. So we have to say everybody's insured. So you're going to treat people. If you have people sick left and right, what are they supposed to do?
Yes, if this gets worse, if this is just the beginning,
based on the numbers,
we're already floundering. What are we going to do if it gets worse?
What's going to happen? 30 million people just file for unemployment. A lot of them get their employment through their jobs.
And mind you, because of that, the infrastructure is not in place to handle that. Those call centers have shut down. When you call these places, they say, due to the overwhelming number of calls, we have shut down. Not we've employed more people or we'll get to you later or we've opened. They have shut down. You literally can't call these places because of this.
I'm just curious, what do we do if they open and people start getting sick all over again without insurance?
So again, it's interesting because, I mean, the White House themselves put out guidelines for reopening, right, which nobody has done. I mean, as of tomorrow, I think 31 countries are going to be open. The government themselves, the White House, President Trump and the rest of the coronavirus task force said, you have to be 14 days of decreasing cases and decreasing deaths before you get to phase 1, which none of our states have had yet. No. I mean, so that is what they're supposed to do, because then not only do you have decreasing deaths, decreasing cases, you also have the healthcare availability, infrastructure, resources for if there is another outbreak, or if there is those that are getting sick, that are dying, that those people can be there to take care of them. That is what was supposed to occur, and it did not, which I'm kind of confused about coming from the top. Most of these states that are opening up, again, from a political standpoint, Republican states like that want to get their economy going, want to support Trump so that he can have, whatever agenda he has behind him. But at the same time, he's the same one that said, you're supposed to do this in this phase with these guidelines, and they're not adhering to them. So it's a little confusing to me. But I mean, to you guys' points, that's what they were supposed to do. They're supposed to have those guidelines in place so that if someone does get sick, someone does start to die, those healthcare resources, those personal protective equipment, those frontline workers are available and not already overrun with everything else going on. So I mean,
So
I'm confused.
the politics of that is those states, especially the red states, they make their money off of revenue, their revenue income, revenue based. And then blue states would be the income tax. So like states in New York, most people can work from home, and because they're more white collar jobs. And then the red states, they depend mostly on the revenue base, the stores being open, et cetera, et cetera. So that's the politics behind them trying to open faster than anyone else. That part, I mean, America, according to the John Hopkins, they're losing what, 25 billion every day they're shut down. So
but to address one of the comments here, I just want to talk real briefly on possible conflicts of interest that have been going on. Obviously, the YouTube CEO just came out right now and said any content that's put up will be taken down immediately that's not in direct correlation with the World Health Organization, which is an international agency and is most largely funded by, Bill and Melinda Gates Foundation, who also are behind this miracle vaccine that's supposed to be coming out right now. And it seems like censorship right now is a big issue on YouTube, on Facebook with their fact checking. If anything goes against what the mainstream media, who's owned by big pharmacy, is putting out right now, they're immediately labeled a conspiracy theorist and discredited, and it's hard for anyone to have any type of opinion, even if there's some fact based on that opinion.
well, if you cite a source and the source is valid, you can make your case. So that's why whatever we say, we have to be responsible for. We could just sit here and talk about everything we want to talk about, like this and that, blah, blah. A lot of what we've said so far, if you can cite a source, which most of us can, I mean, it's not that difficult. The numbers don't lie. If you say over 1 million people have been tested or have contracted the coronavirus in America, which is a third of the world total test positive cases, and then you say 25% of that have died, and that's, I mean, not 25% of that have died. You say this much have died, and 25% of the much that have died have come from America. That's
the testing was so scarce before, and there was so many false positives and false negatives, and they weren't testing anyone that was not severely sick. Anyone that was asymptomatic. An asymptomatic carrier and a healthy individual are going to present the same. So they're not being tested. There's a lot of people they're saying right now that probably have got this. The CDC said that widespread transmission was inevitable. Most of us are going to get it, which means more of us have it than we think and are asymptomatic and probably already built up immunity to it. And therefore the numbers overall are a lot smaller than what's being represented. So you said a valid source. It's tough right now considering net neutrality has been banned. YouTube is now censoring content. Facebook is fact checking. It comes down to dollars and cents, of course. And we know that. We know this is a capitalistic society. And if it's not for profit, then there's going to be some things that are.
You got to vote. I did that net neutrality thing. You got to vote.
I think this pandemic has showed us at least that. At the very least, you really need to focus on the leaders of whoever, and not just Trump, because a lot of people say Trump did this, Trump did that. It's going mayors, governors, aldermen, city officials, whoever it may be, the leadership as a whole, senators. It's really it's very disappointing that so many people that we as a nation have elected or chosen to lead us are really out for mostly profiteering. Everybody is trying to, and it is, what's that? Phil, what's up?
I'm just thinking, I was just waiting for you to finish what you were saying, but since everybody's profiting, that means a lot of opportunities created from a norm. Instead of, there's lots of cases, there's lots of stuff going on, there's a lot of things that are bad. With every bad comes good and opportunity. How do we profit?
We as in black folks, or we as in the couple people that
all of us here? Yes. Anybody who's not, I mean, that's what I'm thinking. I'm thinking, look, so for the past month, I didn't really, and this was something that was posted earlier, I didn't really, just because of how my mind works, I don't think too much about things that could go wrong. This is not how my mind works. Well, I was in Spain and I had to come back. This was, I think, was March 15th, something around there. And I realized that they weren't going to let me on the plane, so I pretended to be a tourist. Then they let me on the plane for some reason.
Right.
Anyways, I got back in. I realized they were shutting down the borders, and I thought, okay, this is a new norm. And so for the past month, there's new property. So what I do is I'm a real estate developer. What I'm seeing is lots of opportunity. Other developers are overextended and they need to liquidate. Banks are shutting down certain projects they want to lend against. That offers opportunity if you have good projects. That allows to pick up new properties. There's one I bid on last year. I was hounding the agent. I put in a bid of 1.9. He didn't answer my calls, and I thought we had a deal. That one, we're putting that one under contract for 1.7. That's number one. Another thing, even with on Instagram, I was talking to my nephew about this. People are stuck in the house. He had there was an extenuating circumstance for him, but he started putting out content. He went from 33,000 followers to 500,000 something.
Of course.
Taking advantage of people being inside. Myself, I had a nothing presence. Now is over 25,000. I'm just putting out videos guerrilla style.
Right.
So what I'm seeing is like there's there's new habits forming, there's new opportunities forming. And I keep thinking, how can we depending on what industries we're in, how can we take advantage of this new norm? If a guy buying up hand sanitizer, yes, it's ruthless. Yes, it's sharky. Sure. But he's jumping on opportunity.
So I think we all, and not we as in the people in this room, but I think we as Americans, that's our mentality. What's another hustle? You know what I mean? What's another thing I could get out? What's another way? But during a pandemic, those things turn into you find ways to do harm to other people in order because I say that if you're taking a necessity and hoarding it for profit, that's basically doing harm to somebody, right?
That is ruthless, yes, and that is capitalism, but it's
right. But in America, it's called the hustle. I'm on my grind. I'm in the streets.
But what I'm saying is, just like something like this now, more people are connected in spite of geography, logistics, borders even. So that's just an example. I think that's a microcosm of the new normal.
The new norm, yeah.
Like, how do we adapt to that? Instead of playing catch up by just watching everybody else sort of form the new reality, instead of playing catch up, how do we create opportunity from this?
Now, see, the problem I think that stems from that is that everyone gets that hustle on how to make more money, on what's the new app I'm going to create, or what's the new so-and-so I'm going to do that's going to blow everybody's mind, that's going to get me money. But now we're not thinking of the health and safety of the people. And that's what I mean by we're so focused on, okay, this is the new norm. I gotta chip up.
Are we really?
I mean, I don't know. I think that's why we're here. Are we? That's good. Personally, I hope we all do well. Obviously, we know some people know each other here, and I hope everybody does well, and I hope everybody makes money and comes out of this better than you went into it. But are we so focused on the new norm and getting my money right and getting my chips up and getting my business together? Or are we concerned with, hey, what are we gonna do? Is everybody gonna die?
I think there's a middle ground there. It doesn't necessarily have to be a singularly egotistical, capitalistic pursuit. What I'm saying is there's a new way we're gonna be doing socializing differently. We're going to be doing business differently. There's a lot of things that were happening before that you won't see now. How do we adapt to it? It's not necessarily being a piranha that's just trying to siphon money from the misery of others.
Yeah.
Is all of us, let's be honest, we're not in a group where we are going to die necessarily. And neither are the ones that are younger than us. So if we're staying inside, I mean, we can look at the statistics and all the grave numbers that we want to, but how do we make sure that we can be better prepared for something like this happening again? Or if this extends far longer than we wanted to, how do we sort of stack our chips? And that's sort of where my head is at.
If health and safety is really the concern right now, why is it that liquor stores and fast food restaurants are open, but yet gyms, parks, and beaches are all shut down? It is funny. Makes no sense.
That's funny.
I think this is a good point for us to segue, because we've been on for about an hour now, and I want to give, I guess, the people who are in the chat with us an opportunity to ask questions. So for the next, 5-7 minutes or so, if anybody here wants to either come on the video and ask a question to one of the panelists, just put your name in the box down there and we'll unmute you and invite you to show up on the screen. But I want you guys to, you guys have all made some really valid points. It's been a great discussion. I see we chose definitely the right mix of people because you guys are all different in your own ways. But I'd like for you all to give kind of everybody that's here just whatever your key points of advice are. It could be whether it's from a medical term or financial or health, whatever you feel you want people to take away from your contribution on this panel today. I'd like for you guys to each go around and kind of give your closing remarks or advice for how to move forward, even in reopening or staying quarantined. What do you guys, what's your key takeaway for everybody here? And y'all can go in any order.
Closing. Oh, well. Stay active. Mental health. I'd say mental health is the most important thing right now, because you're locked up. I know there's people in prison, and in worse cases than I would say all of the panelists here. So you're locked up, but like you said, that can erode the mind. That can really work on your mental. So find something that keeps you active, makes you happy. Find happiness, find joy in something that you do, and revisit that as much as you can, because sitting at home, it's just not, it doesn't seem like it's going to get any better day after day after day on your couch.
Yeah. Thank you, Frantz.
I mean, I can follow up. I mean, from a health standpoint, I would say, stay informed. Don't, I guess, have so much information that you're going into a depression. Please don't do that. But stay informed and know what you're up against. This is a virus. Know how it's spread through droplets. That means someone that's close to you, either coughing or sneezing or whatnot, it can be spread through surfaces that are contaminated as well. Wash your hands. Keep your mask on. Social distance. If you understand what the virus is, how it's spread, what you can do to prevent yourself from getting it, you at least will have a little bit of reassurance from that. The unknowns that we have, we can't do anything about that. But stay informed, know what you can do to help, and realize this is a global health issue. Just because you feel good doesn't mean that you can't give it to somebody else. So let's be a big family, if you will, and take care of the team.
I think we should use this time to really just focus on, like you said, our mental health, our well-being, our physical health as much as we possibly can, and just try to come together. As hard as it seems right now, as divided as we are, politically, racially, economically, just to try to understand that everyone's going through this time of uncertainty. We've never been here before. Just come together. This is not about politics. This is not about Trump is the answer, Biden is the answer. Those guys are selected for us. We don't elect them. We don't have a choice. So it's really just about understanding that we all need one another, and we all need to start with ourselves and just stay as healthy as you possibly can.
I don't have a haircut. My beard is husky. I know Phil didn't get a haircut. Social distancing is still going on over here in California. Somebody said it in the chat. So
okay.
Some places have barbershops and salons open as long as they're social distancing. Some places.
For me, I think what I want to emphasize very briefly is just getting into the idea of why things go the way they go, especially in times of crisis, and it goes back down to politics. Now, yes, sometimes there's a feeling that we're not being heard, or we don't choose whoever we want. I've known elections that have been swung by one vote over time. So I say that to say this. Our healthcare system is broken. In order for us to fix it, you have to put somebody or people in place who will be willing to fix it. Citizens United was a Supreme Court decision that allowed for money to buy our politicians. If we have somebody in place who would repeal or remove Citizens United or take it back to where it was before, where people actually had a say in who they put in, and then they'll represent those people, then we'll be speaking. All I'm saying right now, with all what I'm saying is get active, get involved. When this is all said and done, understand the politics of where you live. I know a lot of people who have big businesses. They don't even know who their congressman is. And a lot of those laws come from that. So understand where you are, understand the politics of how it shapes where you are, get involved. We need the younger people to start. When I saw the panel that was making a decision for women's right, was it a year ago? It was like 19 white men and 1 white woman. Old. The average age there was like 59. I'd never seen anything like that. They were making decisions on what a woman should do with her body. So we got to get involved. We got to vote the people in that we feel have our best and make our demands. Only a few days ago, there were guys who went into the Legislative Capitol building with military weaponry to go make a. Listen, it's their right to protest. It's in the Constitution. Make your demands. Before you go out there to vote, know what you want. Get a coalition together. Make a demand.
And think of the pandemic. Think of the time you're spending now, and know that your elected official, we need to put the right people in office clearly, because usually we just live in day to day, and we just, we skate through the year. Lakers hopefully win a championship. LeBron James doing this. Steph Curry hit how many threes, and that's all you're really worried about. But now when the pandemic has hit, and now you understand why your elected officials matter, why voting matters.
100%, 1,000%.
This is why. Not when we chilling and everything's good.
Yeah. Thank you, Dupree.
So my key takeaways would be similar to the others. I would encourage everyone that's involved in some type of business to think of ways to, how can you evolve during this time to expand your business? What things can you do differently that you could continue afterwards also? Of course, seek advice from your healthcare professionals. That's what we're here for. We're, always ready for questions and, have answers available. And it's about staying healthy. So the virus is here. It's a serious thing. I've seen it. I know people that's out in the hospitals in New York working. It's a serious thing, right? But we're going to get past it, like, all the other things that came through, smallpox and all of that. There's going to be an end. We just have to be patient and learn about everything and figure it out going forward. So, of course, like Dr. Brian said there, continue with the social distancing, proper hand hygiene. You also should, take measures to boost your own immunity, whether it's taking vitamin C supplements, your daily multivitamins, exercising. Mental health is key. If you're mentally fatigued, it makes you more prone to disease. So you want to continue that, as well as, think about, zinc supplements. So things that are going to boost your immunity to keep you healthy, as well as practicing those other social distancing and other mechanical barriers that are in place right now until we can figure things out.
Thank you, Nick.
Get up, walk around, don't sit on the couch all day. I spent all yesterday on the couch, yo. I'm not gonna lie. I spent all day yesterday on the couch. I got up like late last night. I was like, I ain't do nothing. I just walked around the crib, but I was just thinking, yo, I didn't walk at all yesterday. That was terrible. I watch movies and play PlayStation though. I also write though. I'm not like a total loser.
All right, Philip, what you got?
There's nothing I can leave people with. 3 takeaways, really. And of course, electing officials, you know, stuff outside of our control, really. And the people passing the law, stuff out of our control, right? So what I want to highlight and for people to take away is really 3 things, all centered around becoming, and it's not to sound like some sort of self-help guru or anything, but centered around becoming a better version of yourself. So essentially right now, since the stock market went down, there's so much opportunity. There's so many stocks right now that are cheap, that are undervalued, that are underpriced. So set this time up, more importantly, to set up passive income streams. That's the pillar of any billion-dollar fortune. And it's something you can do for $100 right now. So and that has nothing to do with whoever's in power or the Illuminati or anything like that. There's something you can do right now. There are stocks that are trading right now that are giving you 6, 8, 10% dividends. Buy some municipal bonds. It's about the safest investments that you can do. You can set up 3, 4, 5 passive income streams and start with what you have. So that way, if something like this should happen or if this extends, you're well positioned. And 10 years from now, you'll be in a totally different place. That's what I would say. Set up that. One, learn a new skill or read something that will improve you because you're stuck in the house. So yes, I guess a PlayStation and Xbox is fun, but so is was that app Blinkist where you can read book quickly, or Amazon or Kindle or Nook. Those are another thing. And the last thing is, what was the third one? You take advantage of this opportunity to improve your personal network, because you know there's just a basic law of life that you become your environment. So if your environment sucks or the people you talk to suck or they're not at the same level that you're at or where you want to be, is the easiest time to get in touch with people right now, because they can't really pretend that they're busy because they're not. So that's what I would say.
Shoot your shot, everybody. Shoot your shot.
You know, and network up, get a better circle, learn some new shit, and then set up passive income streams for the future. See the opportunities that are out there because they're everywhere. I have heard more numbers here than I've ever heard because I don't pay attention to it. I honestly don't. And I say, okay, we got to be inside. Cool. Now, how do I make the best of it? So that's what I want to leave people with, really personally.
That's
Philip,
awesome.
do you provide stock tips and real estate tips on your platform?
Excuse me?
Do you provide stock and real estate tips on your platform?
I absolutely do. That's what the whole thing that I did. Ironically, my first video was how this whole pandemic can make you rich. One of the things I talked about, start a blog, whatever, your Instagram page. And that's ironically what happened for me. So I put up different passive income tips, and not trying to shill or plug anything. You can look at my stuff if you want to, or you can just look at different sources, Investopedia, Food.com, WealthLab.co, different things. That is actually mine, so that was a plug. But what I'm saying is, information out there, learn it, and then be prepared.
How can everybody find you?
My YFWT.
Looking back, turning into the.
No, it's not about that. What I'm saying is, learn those skills. Like I bought like a stack of books that and not to say like, oh, this is great, but it's just to learn some new stuff, you know. And again, different instruments that you can invest in. Like I said, municipal bonds yields are very high right now. There's like a 0.003% risk of default. Is like it's non-existent. Certain stocks you can get in now, and then when there's another drop, you buy some more. When it stabilizes, you're set. Not set, but you got a head start instead of catching up when everything is recovered and rebounded. But I'm going to shut up now. That's the three takeaways that I will leave everybody with. You know, I don't care for the numbers, and you couldn't care less. It's about the opportunity.
And then one thing I forgot to throw in there that, I wouldn't feel comfortable, since I've been telling everyone around me, all my friends, family, I think it's important, if you can, please go get tested. Like that is going to be very important, especially because, a lot of people are asymptomatic, don't have a fever, very mild symptoms, may just have a headache. Get tested. That'll help prevent the spread, and it'll help protect yourself and your people around you. So if you can, preferably find the free testing sites, but try to go and get tested, okay?
That's dope. Well, thank you all so much. I have Amber. She wanted to ask a question or make a statement before we hop off real quick. But if you want to follow any of these gentlemen here, their names are actually their Instagram name is in the box with their pictures. So definitely go follow them. and keep in touch. So Amber, I'm going to unmute you.
Oh, I want to apologize for jumping in earlier. I didn't know it was focused.
No, you're fine.
Philip, like I totally agree with everything that you shared. You basically hit the nail on the head. And that's what I was basically speaking about earlier. Like a lot of us, especially particularly people of color, we tend to focus on what we're losing and not focus on what we can gain. And I jumped on the stock markets 2 weeks ago and made $2,000. Didn't know stock language or anything. Jumped on it, made $2,000, did a webinar, invited my friend in and asked him to teach people how to invest in stocks. And so this is an opportunity. Like I know Frantz was basically speaking on, focusing on health and how, maybe we should not, or how people are taking advantage of this opportunity and, being vultures and, buying hand sanitizers and stuff like that. But there are other opportunities that's not capitalizing on the deaths of people or that's not taking advantage of it. And like right now, like you shared earlier, this is the moment. Like if you wanted to make money from stocks, I literally made $2,000, do it. If you wanted to start a business, like you can allow your business to evolve by doing some stuff online. And as a result of me just taking advantage of those opportunities, yes, focusing on my health and making sure my family is okay, but also looking at the different things that are out there for me to be a part of, I came up hard. Like I came up. And so that's something, Phil, you hit the nail on the head. I just think that in this pandemic, you cannot leave your future up to the government. Right? Because what's happening is that the rich is getting richer and the poor are getting poorer, and they're passing laws to protect the rich. That's just what it is. And so you definitely have to have flexibility. You definitely have to be able to adapt. You don't know that once this pandemic is over, if your job is still going to be available. And if you don't focus on your finances at this time, then you're basically putting yourself to experience mental distress. Because some of the issues that that takes place, some of the mental issues that some of us have sometimes stems from the lack of resources. Yeah. So I would just say, yes, focus on your health, but also focus on ways. It's a great opportunity for anybody. I have friends in the hood that jumped into the stock markets, and my one friend bought a new laptop. I just taught him how to do it. He bought a new laptop, made $500 in a day. So this is an opportunity to jump on opportunities that's out there.
I think that I would say my people, I would think that I believe that my people as a whole kind of have always overcome.
Absolutely.
In this country and around the world. So, and I know that myself, see, I don't want to speak about the things that I'm doing because what I'm doing is not what everyone's. I'm trying to generalize all of this for people. So it's very good what you did, but as soon as the pandemic started, I was in the house thinking of other ways to make money, think of other ways to improve my life, obviously to come out of this better than I went into it, to have something solid when I come out of this. And I hope, I just believe in us. You know what I mean? I honestly, I think that we're all at home with this much free time. Everybody's coming up with a hustle. I personally just don't want to see more of this. I'm going to capitalize with my foot on your throat mentality.
Yeah.
You can capitalize while holding each other's hands.
Exactly. That's what my concern has become, just watching Kelly Loeffler and the senator that, you know, insider trading, maybe just people capitalizing off other people's suffering is that's the American way, honestly. And I just like to see it stop personally.
Yeah. Well, this was a great town hall, great panel discussion. I appreciate all of you for tuning in. I usually always just say protect your mental health, protect your physical health, protect your emotional health through this. Make sure you have the right people around you to be able to support you in this time, whether that be virtually or in person, however you choose to move forward. But we'll get through this together, and we'll get through it probably quicker than we all can imagine right now. Thank you guys so much. This was a great panel, and we really appreciate everybody for tuning in. Shout out to Black Wall Street for hosting. Make sure y'all follow.